to get reimbursed for porcelain onlays, you have to prove pathology. Now, on the clinical side, proving the pathology is the most important thing. Now, usually insurance companies require a periapical x-ray. So make sure you always take those. Even if you feel like the insurance company doesn't need it, it's pretty standard that you're going to need at least a PA. And it's good practice anyway to make sure there isn't any periapical pathology happening. The team also needs to do their due diligence and call the insurance company and confirm that these codes are actually paid for. As you know, with x-rays, they're just a two-dimensional picture of a three-dimensional thing, and you may see a little bit of decay interproximally, but if that's all that you show, that probably is not going to give the insurance company enough information to say, yes, an onlay was warranted here. I highly suggest that you also include photographs. One critical photograph that you must take is a preoperative photograph. Take a picture of the entire quadrant or the tooth where you can see maybe the blue haze around an amalgam, or even a fractured cusp or crack lines with stain. Anything that you see clinically before you actually do the treatment. One thing you should not do is prep away the pathology. What I mean by that is, let's take amalgam for a minute. Get all the amalgam out and do it carefully so that you can actually expose all the leakage and maybe a fracture line that's underneath that amalgam. And then you take a picture of it. Don't prep the tooth for the onlay and get it all cleaned up because you have nothing to take a picture of. You just lost the opportunity to prove that an onlay was warranted. In order to do this predictably, you need to make this a routine. Your digital camera needs to be right there, ready to go on the fly so that you can take a picture of it. Okay, so let's say you got a denial on your onlay. Well, you should be aggressive about this because the story's not over. Don't take no for an answer. You already have your x-rays that you took. You already have a preoperative photograph. You already have a picture that shows the pathology, or what I call the yuck picture. So you already have all of that in the chart. Write up a quick letter, and it's easy as this. First paragraph, you'd say something like, you reviewed all the problems with the patient, the crack line, the recurrent decay, whatever it is that warranted an onlay or crown or a filling. I highly suggest you using a phrase similar to this. This was done in the best interest and well-being of the patient. This is a critical sentence that basically is saying, hey, listen, we treated the patient at the optimal level so that the tooth would last as long as it possibly can after reviewing all of the options. I hope the suggestions that I gave you today will help you and your patients get the benefits that they so rightfully deserve.